All right, hi, my name is Sebastian Saw, and today I'll be looking at healthcare differences between the United Kingdom and the United States. So they have two different types of healthcare systems. In the United Kingdom, they have a fully universal free healthcare system that's government sponsored, and that goes through the National Health Service. And it consists of separate health services provided for each country, which are Northern Ireland, Scotland, England, and Wales. In the United States, we have a different healthcare system. It's provided by both public and private organizations. And the public programs include Medicare, Medicaid, Children's Health Insurance Program, Veterans Health Administration, and it is not universal. The first statistic we'll be looking at is cardiovascular disease mortality per 100,000. And this is an important statistic because cardiovascular disease is the leading cause of death in both countries. In the United Kingdom, the incidence rate during the year 2015 was 264 deaths per 100,000 people. And that ranged from a low of 254 at Northern Ireland all the way up to 320 in Scotland. In the United States, the mortality rate is actually significantly lower, averaging out at 165 deaths per 100,000 people. And it ranges from 115 deaths per 100,000 in Minnesota, and it goes all the way up to 233.1 in Mississippi. So even the highest rate of death in the States is lower than the lowest in the lowest region at the United Kingdom. The healthcare spending per capita, United Kingdom spent about 10% of its GDP on healthcare. The GDP is a gross domestic product, and it kind of measures the overall wealth of a country. And that amounts out to $3,700 per capita per person. In the United States, we spend significantly more. We spend about 17.2% of our GDP on healthcare, and that is almost twice as much as the United Kingdom, and the United States has the highest GDP of all nations. That counts out to almost $10,000 per capita. That is a spending that is 2.5 times greater than that of the UK. The next statistic we'll be looking at is the emergency department visitation rate. This is an important statistic because it shows spontaneous health needs, and these are completely unplanned health visits. In the United Kingdom, we see 23.57 million visits annually, and that counts out to about 35,000 visits per 100,000 people. In the US, we have a significantly higher rate of ER visits. We have 136 million visits annually, so about 1/3 of the population of the United States goes to an ER every year. And that counts out to about 41,000 visits per 100,000 people. And that is a number that is 20% greater than that in the UK. The next statistic we'll be looking at is the childhood vaccination rate, ages 19 to 35 months. This is a very important statistic because it shows the investment that the United States places in preventative medicine. United Kingdom, in 2017, they are declining in 9 out of the 12 vaccinations. They're hovering around 91.6% vaccinated for measles, mumps, and MMR in 2016 to 2017. And it's slightly lower in the last year, where 91.2 were vaccinated for the same diseases. These are the lowest levels since 2011. And the goal vaccination rate is 95%, so they're about 4% short of their goal. In the United States, 92% were vaccinated for polio, 91.5% were vaccinated for MMR, 91.4% were vaccinated for hepatitis B, and 91% were vaccinated for varicella. So these are numbers that are similar to the UK, where they're hovering around the 91-92% range. The alarming statistic that I found was that only about 60% of people were vaccinated for hepatitis A, and approximately 70% were vaccinated for the 7 vaccine series, rotavirus, and hepatitis B birth dose. The next statistic we'll be looking at is secondhand smoke. In the United Kingdom, it caused an estimated 11,000 deaths per year. 80% of the deaths were caused inside the home, and 20% were caused by secondhand smoke in the workplace. In the United States, we see a significantly higher rate of death, where there's an estimated 34,000 deaths per year between the years 2005 and 2009 in the United States. It causes about 7,300 lung cancer deaths annually between 2005 and 2009. And exposure to secondhand smoke has decreased significantly in both countries due to past legislation that increases tax for cigarettes, and also just increased education and awareness about the negative health effects of smoking. The next thing we'll be looking at is the uninsurance rate. So in the United Kingdom, they have a universal healthcare system that is government funded and sponsored. So they have virtually no uninsured people. As long as you're a citizen of the UK, you will have health insurance. However, in the United States, we have, because it is not a universal healthcare system and it's public and privately sponsored, there are about 15,000 people that are uninsured per 100,000 people. This was just last year. And the uninsured rate rose about 3.3% since 2016, so it's going slightly higher and it's trending that way right now. The next thing we'll be looking at is the unemployment rate. The United Kingdom and United States share similar unemployment rates trends. In 2018 in the United Kingdom, the unemployment rate was about 4.1%, which is pretty low compared to the 8.1% they experienced in the year 2011. In the United States, last year they had an unemployment rate of about 3.9%, which is also significantly lower than the 9.6% they experienced during the year of 2010. And this was because of the recession. The recession caused a spike in unemployment around the years 2008 to 2011. And you see these effects portrayed onto the unemployment rates per 1,000 people. So in conclusion, the United Kingdom spends almost half as much money as the United States does in healthcare. They spend significantly less per capita, and they also spend a significant less amount portion out of their GDP. The United Kingdom also has less ER visits per capita than the United States. The United States had about 20% higher ER visitation rate per 100,000 people. And the United Kingdom also provides free universal healthcare to its citizens, so everyone has access to free healthcare. And the one difference that the UK did worse on was cardiovascular disease. Cardiovascular disease was significantly higher in the UK than in the United States. The highest point in the United States cardiovascular disease area rate was still lower than the lowest UK rate. And conclusion, a government universal healthcare system is much more affordable than the United States healthcare model. This is something that is completely doable in the United States. It will require a lot of change, but it is definitely achievable and just better in general. These are my references, and thank you.